Welcome to this episode of Ask CPS. Today I'm joined by Dr. Halley and Dr. Guevara. Welcome to the program.
Thank you.
Thanks very much for joining. Today we're going to be talking about oral hygiene in anticipation of World Oral Health Day, which takes place later this month on the 20th. So what better way to start? One best foot forward on the 1st of March, and we're going to discuss some of the common diseases that we see and here on St. Martin as well as globally, and then look into some of the preventative measures, changes to diet and lifestyle to help with our oral hygiene. So initially, I'm going to bring in Dr. Halley, and certainly for my personal interest and maybe the interest of our listeners, how did you first get into dentistry?
Well, I always had a love for biology and chemistry. My first passion was really to become a pilot, but anyway, that didn't work out because of the math. But I always wanted to get into the health sciences, and biology was my strong point. And since we moved from Aruba to Venezuela, the first year of health sciences it's a common year for everybody. All the students, and one of the lectures was held in an auditorium at the dental school, and I would pass close to the pre-lab of dentistry, where I would see the dental students already homing their skills, drilling in tapodonts, in plastic teeth. And that really caught my attention on how fast they put you in contact with patients and so, and there is where the bigger love for dentistry came about.
So from there you spent some time cutting your teeth, I suppose, in Venezuela, and then I understand you moved to Dominican Republic before coming to St. Martin?
Yes, I started my career in Venezuela. I finished my career in the Dominican Republic in 1987. And then in 1988, I did the proficiency examination to get my Dutch license to work on Dutch territory. So since June of 1988, I've been on the island of St. Martin.
And since your arrival, what would you say are the most common oral diseases that you've witnessed here?
The most common is tooth decay, so cavities, and periodontal problems, gum disease, ranging from gingivitis all the way to advanced periodontal disease. And naturally, because of those two main diseases, we also end up with a lot of patients being edentulous, missing teeth. So I would say those are the two most prevalent oral diseases on the island.
And Dr. Guevara, I can bring you in here if you don't mind. I know that roughly 3.5 billion people worldwide are affected by some kind of oral disease. And I should imagine tooth decay is almost certainly number one amongst that. Could you explain why you think that is, and whether or not we also see the same trend here on St. Martin?
Yes, actually, yes. Still, tooth decay is the first, or at least also is the first, the main reason why people go to search for care or treat it because of the pain. Other diseases are not painful, so there is another story. The main reason is also a combination of three factors that we can see the same chain here in St. Martin. That is diet, quality of the tooth, and how the persistence of the bacteria that produce the decay. No? And it means we have these three factors that combine, and then the decay is produced. is that the reason that we have here the case in San Martin is a combination of education and diet. I would say more than nutrition factors. The quality of the tooth is also play a factor because we are a multiracial international community. So there is a lot of people actually that do not grow here in San Martin and don't have the same opportunity of nutrition when they were kids. So you also see the quality of the teeth in those individuals are not so well. But for basically kids or San Martinists in general, it's basically as a matter of education. A lack of interest in brushing and flossing and use all the tools, and also the diet. We have a diet really full of carbohydrates and candies and sweets, and the bacteria that produce the decays are eat those carbohydrates and then reproduce themselves very, very, very fast. And that is the main reason. Another factor that we see here a lot is also combination of both, the combination of diabetes and periodontal disease. That is very, very important to be discussed and to people to have awareness about it.
So let's try to zoom in on some of the issues that cause tooth decay. I'd like to stay with Dr. Guevara just for the moment. So I guess some of the risk factors you've mentioned are diet, and why would diet be one of those risk factors?
Well, because when you have a diet rich in sticky, starchy, and food, that is going to stay in your teeth longer. Okay, if you use more fibers, then it's gonna go faster. Also is a combination of diet and our daily routine. That fact that brush after each meal is not a reality in our speed of society that we have now. Most of the meals are not done at home anymore. So the space in between that you eat and you brush is too long. So the bacteria have all the time to, as I said to the kids, to party in your mouth and produce the acid that is gonna attack your teeth. Remembering that after 10 minutes, any meal, even a healthy apple, you're gonna have an acid attack. So after each snack, you're gonna have an acid attack. So, or either you brush, or either you rinse, or either you drink water. But sometimes we forget about it. The kids are in the school, the people is working, you have a little snack and you keep. And also we, as in Latin America, we actually, and in Caribbean, we have a diet really rich in starchy food and carbohydrates, rice, pastas, potatoes, bread, is everything that we love. So yeah, it's difficult. It's difficult to remove that from your diet, or remember that you have to brush, or remember that you have to rinse immediately after. No, it's not easy.
So on one hand, we've got diet that's playing an important part. We know that starchy, sugary foods, the absence of brushing at key moments can contribute to tooth decay. But I've noticed also that in our toothpaste, we have a substance called fluoride. And I also know that in the UK, we add it to our water. So Dr. Halley, perhaps you could give us a little bit more information on how fluoride works and how important it is to keep tooth decay at bay.
Okay, fluoride works by two mechanisms. One mechanism is when you ingest the fluoride, it incorporates in a developing tooth. So that's why it's very important that growing children do get a certain amount of fluoride that would help make stronger teeth. It's even so that in some countries, pregnant women, when they reach the stage where they're going to be getting iron supplements, folic acid supplements, they also receive fluoride. Because again, the enamel is formed by a component called hydroxyapatite, which is calcium phosphate. And the calcium phosphate molecules are held together by an OH molecule. Now, when you have an intake of fluoride in a growing child, in a baby and a growing child, that OH molecule is changed by a fluoride molecule, which makes it a much stronger bond and a much more difficult to penetrate bond by acids. The other way that fluoride works is topically. So that's where you get it in toothpastes, in mouthwashes, and when you go every 6 months to the dentist, they place the fluoride topically. And this works because of the following. The main culprit of tooth decay is a bacteria called the Streptococcus mutans. And the Streptococcus mutans enjoys sugary substances. So when that sugar stays back, that sugar is used in a process, in a biochemistry process called glycolysis, where this bacteria, which is an anaerobic bacteria, gets oxygen and gets energy. It's a reaction, it's a cycle, let me put it like this, that consists of 8 chemical reactions. And in two in the areas of that chain of reaction, the fluoride acts as an inhibitor, meaning that once fluoride is placed there, those reactions cannot continue, so that bacteria does not get oxygen, does not get energy, so it will die out. So the fluoride is working as a bacteriostatic substance.
So then, as far as I understand it, the best way to look after our teeth is to ensure regular brushing, to minimize our sugary intake, to brush regularly, to have fluoride as part of our diet, either through our water or through our pasta, however it's added, but also to have it in our toothpaste to inhibit that process that the bacteria use to break down the sugars into acids that attack our teeth.
Yes, exactly. Exactly.
Great. Okay, so at this stage, I think it's probably good for a break. We can allow our listeners to digest that information, and we'll come back for the next session shortly. Thank you very much.
Vaccines saves approximately 2 to 3 million lives every year and are therefore one of the most effective medical intervention ever invented. A vaccine protects you, but additionally it also protects your family, friends, and vulnerable people in your community. The more people get vaccinated, the harder it will be for the virus to spread. When enough people are vaccinated to create herd immunity, it can put an end to the pandemic. The government can then scale down the coronavirus restrictions and the tourists can return, which is vital for our economy. The COVID-19 vaccine will be free of charge for everyone. It is not mandatory to take the vaccine, but it is highly encouraged. If you have questions about your own specific situation, discuss them with your doctor. In the meantime, we must be responsible and keep practicing the COVID-19 safety measures like wearing your mask, washing hands, and maintaining social distance. This public service announcement has been brought to you by the Department of Collective Preventive Services and the Department of Communication.
Hello and welcome back to this episode of Ask CPS, where today's guests are Dr. Halley and Dr. Guevara, and we are talking about oral health and hygiene. Previously, we discussed a number of good practices that one should be mindful of if trying to take care of one's teeth. And this session, we're going to talk a little bit more about some of the FAQs and some of the contraindications of and comorbidities of disease. So the first question I have for Dr. Halley is, what are the most common frequently asked questions?
The most common question is usually, is this going to hurt me? No. The most common question is that, you know, patients usually come into the office with a toothache. So when the situation is already maybe a little too advanced, and you know, the first question is, can you save this tooth for me? I want to save this tooth. The second question is, yes, quite honestly, is this going to hurt? um, the questions are sometimes really related to how can I avoid this from happening again? Okay, so after, you say, oh yes, this tooth, we can save it via this and this and this procedure. They're like, okay, how can I avoid these things from happening again? There are also usually questions like, are x-rays necessary? They question about the safety of x-rays. They question the safety about materials, also to dental materials. Slowly but surely, the people are getting a little bit more aware of that. Oral health is something very, very important, and the questions are related to how can I prevent this? How can I avoid this happening to my children? I don't want them going through this experience, and so these are the most frequent questions that we get.
And just to touch on something that you mentioned about the safety of the procedures that are performed, of course, I don't want to speak for you, but x-rays and some of the other procedures that you're performing, they're all within the guidelines and they're all entirely safe. Can you elaborate a bit more?
Yes, I think most of us now here on the island, we use digital x-rays, and with digital x-rays, the exposure time of that radiation beam has been reduced by almost 90 to 95%. Okay, lead aprons are being used also too. Okay, so the necessary precautions are taken when x-rays are taken, and that is why it's also important that patients, especially women, fill out the registration form correctly if they are pregnant or if they suspect that they are pregnant. That's very important.
And sticking with most commonly asked questions, I feel that there's always a question mark over flossing. You speak to some people and they say flossing is really good for you, they do it regularly, and other people don't believe in flossing at all. So could you lay some of those myths to bed?
Okay, good oral hygiene, good oral health consists of several things. Number one, proper eating, which is something that a balanced diet, low in carbohydrates. But also to something that's very important is brushing and flossing. The brushing cleans the outer surfaces of your teeth, while the floss not only gets in between the teeth, but they also get down into the gum a little bit. All right, the first part of the gingiva of the gum is called the sulcus. And now, under normal circumstances, that sulcus is anywhere between 1 to 2 millimeters deep. And the floss is the only utensil we have that can get underneath there. Yes, we have now water pick because, we are into technology things. And some patients, they purchase a water pick. A water pick is a very useful utensil as long as you know how to use it properly. The safest way is with a floss. The floss can get down into that sulcus. It cleans the interproximal area from the tooth. It goes down into the sulcus. It also removing debris. But one of the things that flossing also does, it massages the interproximal papilla from the gum, promoting blood flow. Now, the flossing is something that should happen not only when you eat certain foods. The flossing is something that should happen after every meal. And I know that sometimes we are now a society that we are on the go, so we eat a lot on the road, and the opportunity of flossing becomes very, very limited. I do recommend that one good flossing a day at night before going to bed is extremely important. extremely important. Once you go to sleep at night, it's the longest period of time that you spend without eating nor drinking anything. So if your teeth are clean, your gums and the enamel will appreciate that. But if you go to sleep with plaque, with food residue stuck in between your teeth, under your gum, this is a sure indication that there will be fermentation of these foods, and there will be the presence of bacteria causing gingivitis, and if it's not treated adequately, periodontal disease. Something else. Oh, sorry.
So let's. I think that certainly that information that I think is clear to me now, and I am going to be a big advocate of flossing. And let's move the conversation on slightly. I'm going to stay with Dr. Halley for the meantime. I just want to talk a little bit about systemic illness and how some comorbidities can also influence or be influenced by oral health.
Yes, patients, for example, a diabetic patient. A diabetic patient, when they don't take their medication the way they are instructed to take their medication, you get spikes with the levels of sugar in their blood. And one of the areas that gets affected first of all are the gums. They get bleedy gums, they get puffy gums, and once you see that they start taking their medication on time, all of that subsides automatically. Okay, over a couple of days, you notice the change. You have certain patients also too that are on beta blockers. This is a heart medication, and you do have a percentage of patients that develop what we call hyperplastic gums. So their gums tend to swell, and these patients will have to take some extra precautions, visit the dentist, visit the hygienist instead of every 6 months, maybe every 3-4 months, making sure that the gums can come back to some normality, okay? But more importantly, to keep them clean and to keep them as healthy as possible. The same thing with certain medications for epilepsy. They do have an effect on your gums. Certain mineral and vitamin deficiency. It's surprising, but here in St. Martin, you do get persons that don't have or cannot afford a balanced diet, and certain deficiencies show up, and it reflects in their oral health.
I'd like to bring in Dr. Guevara now, also on the same topic of medication and periodontal disease. Do you have any particular case studies or anything else you'd like to add on this theme?
Yes, it is very interesting, and the relationship in between periodontal disease and diabetes, specifically in this point, especially here in San Martin, that we have a high rate of diabetes and periodontal disease and combinations. As part of CPS, I had the opportunity to, because besides the Youth Health program, we have the community program, and as part of it, we have the opportunity to make checkups to a big amount of people, especially people 70 years and older. And we saw that 90% of them have this combination, periodontal disease and diabetes. For many years, they were like treated separate, and that is very well documented already. There is two-way road in between them. And if you don't balance one, the other one is not going to be balanced never. If you don't take the medication, then you're not going to balance your diabetes. But if you don't do it, you don't take care of the chronic infection that you have in your mouth, that energy or all those medications are not going to work. There is another relationship in between the medication for arthritis and arthrosis and tooth infection. So it is very important to work combined, and if your physician do not ask you, go to the dentist, and I will ask also the physician to ask their patient to please open their mouth, or ask them, do you feel your mouth dry? Do you feel you feel like a sour taste? Do you have toothache? Do your gums are bleeding? And if any of those say it's answered as yes, please refer it to a general checkup, and then we can work together, because it's really, really important, and the numbers are really impressed, and it can be controlled. It can be, as Dr. Halley was saying, is introducing a new tools in your hygiene, then the balance, it can be reached, and it's not so complicated in every case. In most cases, it's really easy to control. It's a matter of also have a willing to do it, to change the habit of how you brush. We learn how to brush when we are 2 years old, but that doesn't work when you are 40, and that doesn't work when you are 50. So you have to be open, the patient has to be open to really make those little changes that are going to change their life. It is really, really important, and it can be done.
So I'd like to, at this stage, thank both of our speakers. It's been a fascinating discussion, certainly in aid of World Oral Health Day. But of course, oral hygiene is a daily event. We need to be brushing regularly, trying to avoid those sugary, highly starchy foods, maintain a balanced diet, and ensuring we use toothpaste with fluoride, and also promoting health and well-being for our neighbours, and promoting regular checkups. So I'd like to thank both of our guests once again.
Thank you for having us.
No, by the contrary, thank you for giving us an opportunity to reach the people, and to answer a little questions, and always there.
Yeah, you're very welcome. Okay, so that's it from us on our CPS. Until next time, thank you very much.